COVID-19 virus outbreak has been denoted as one of the severest pandemic known in human world. As per World Health Organization, coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. This video is an awareness spreading attempt of Innovation Society for general public to help them fighting against this pandemic with better knowledge and awareness. This awareness campaign is developed by Nirmal Integrated Consultancy, that is formerly known as Team NIC, and is patronized by International Association of Research Scholars (IARS) along with many others as mentioned in credits, in last few seconds of the video. To equip yourself against COVID-19 outbreak, you should know quick facts about this virus and its modes of spreading. Coronavirus are the viruses that circulates among animals, but some of them are also known to affect human. The 2019 novel coronavirus was identified in China at the end of year 2019 and as a new strain threat has not previously been seen in humans. COVID-19 infection mainly affects the respiratory system of humans. Common symptoms of COVID-19 infection in a human being include fever, trouble in breathing, cough, nausea, and vomiting. COVID-19 virus spreads through air by coughing and sneezing. It spreads with close contacts such as hugging, kissing, handshaking, or even touching an infecting person. It also spreads by touching an object that an infected person has touched. It can infect a person if eyes or nose or mouth are touched with infected hands. So, now you know that COVID-19 spreads with touches, and hereby any mode of covering your mouth, and habits of frequent hygiene can help you stay away from its infection. You should wear a mask, wash your hands, clean and cook well vegetables, and do not delay to consult a doctor if you are sick. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose or mouth, when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. You must avoid any close contact with someone sick. Big no to hugs, kisses and even handshakes. COVID-19 mainly spreads from an infected person to other humans through droplets of saliva or discharge from nose, but it can also be left on the surfaces of objects touched by infected uncleaned hands, and from there, it can infect any healthy person too, if the healthy person touches the infected object surface. If you touch a contaminated surface and then touches your eyes, nose, or mouth, then the virus may infect you too. You should always be alert and conscious against touching any unfamiliar object like doorknobs of public area, lift buttons, chairs and sofa of public areas, mouse, keyboards, and screens of computers or gadgets used by multiple people. COVID-19 can be prevented from spread by awareness, alertness, and joint efforts of communities. You should follow hygiene practices and clean your hands and mouth frequently. You should practice respiratory etiquette, for example, by coughing into a flexed elbow. You should avoid touching your eyes, nose, and mouth. You should wear masks and keep your nose and mouth covered. You should maintain social distancing and avoid crowded places. You should avoid close contact with any sick person. You should frequently clean and disinfect objects and surfaces of frequent touches like doorknobs, tables, hand rests of chairs etc. COVID-19 can be prevented from spread by awareness, alertness, and joint efforts of communities. This is not tough to remember, only 5 rules that can prevent spread of COVID-19 and help breaking its chain. Simple 5 rule to save yourself. Rule 1. Do not panic. Just do not panic if you feel you are sick. Just do not panic if you feel someone near you is sick. Just do not panic if you get any unverified news of virus outbreak. Be informed that less than 2% of infected people have died. Hereby it is much sure that its mortality rate is not high and one neither needs to panic nor to spread panic. Stay calm, stay informed, stay alert about the symptoms. Follow the instructions from authorities about quarantine yourself, consulting a doctor, and taking medication. Follow the instructions of authorities about getting admitted to hospital or getting quarantine at home. Stay alert and do not fall prey of any rumors. Do not become your own doctor and never try to treat the infection with self-prescribed treatments. Consult the doctor if you are sick. Yet in any case, do not panic and support the authorities as per their instructions. Rule 2. No handshakes. COVID-19 spreads with touches. So, stay away from handshakes. You can follow namaste, hand wave, or other signs of greeting. No handshake, no hugs, no touches. Rule 3. Frequent hand wash. Follow cleanliness and hygiene habits. Frequently wash your hands with soap or sanitize your hands with alcohol-based sanitizers or hand rubs. Follow 5 steps of hand wash to maintain cleanliness. Wet your hands, lather with soap, rub and scrub, rinse with water, and finally dry with a clean towel or cloth. Frequently, repeatedly, and thoroughly wash your hands and practice cleanliness. Rule 4. Social distancing. Social distancing or physical distancing means to keep space between yourself and other people outside home. COVID-19 spreads mainly among people who are in close contact within about 6 feet. Spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land in the mouths or noses of people nearby. Social distancing hereby can effectively prevent the spread of COVID-19 by avoiding spread of cough and nose discharges from one person to other. Maintain a minimum 6 feet distance with other people when you are outside your home. Do not gather in groups, do not make public gatherings. Avoid any crowded place. Do not travel if not necessary. No tours to others' places or relatives, and avoid guests until impossible. Rule 5. Wear mask. COVID-19 spreads through droplets of saliva, cough, or nose discharge of infected person to a healthy person. Covering your nose and mouth with a mask can be a crucial step in prevention of spreading of infection. Especially, if you are a food delivery worker, or a shopkeeper, or works at a supermarket, you must wear a mask. If you are visiting a public place, a supermarket, or a milk shop, wear a mask. If you are using a public transport, wear a mask. Always keep your mouth and nose covered with the mask and make sure that no space is left between your face and the mask. Mask should be tight enough to touch and hold your face tightly and no space left in between. Keep following these 5 rules and stay away from any rumors. Rely only on authentic information and news from authentic sources only. For the verified information about virus outbreak in India, you should visit the website of Ministry of Health and Family Welfare of India or simply mygov.in. For getting any support in case of need, please use helpline number 01123978046. Alternatively, you can dial 1075. You can also email to the government help desk. One of the easiest and quickest way to get help is through Arogya Setu app that is available for any smartphone working on iOS or Android platform. Download Arogya Setu application and stay safe from COVID-19. We all thank you for watching this video and we request you to contribute in the fight against this virus outbreak by following the instructions of authorities and practicing the 5 rules as mentioned in this video. This video has been brought to you by Innovation Society in association with Nirmal Integrated Consultancy, International Association of Research Scholars, Amity College, Florida, WAIMS, and Business Press India. The video has been developed and featured with the support of Professor Deepak Jain, Mrs. Deepa Jain, Ms. Seema Gahalawat, Dr. Shivani Raheja, Professor Ripu Ranjan Sinha, and Dr. Sanjeev Seth. TTS support is used from wido.co/text-to-speech. Thanks for watching the video. Thank you very much.